Okay. Anyway, update on COVID activity. Things are pretty good nationwide and locally, but they're not perfect yet. Things are getting better. There is still a lot of concern as to what might happen during the Thanksgiving and Christmas and Hanukkah and other big family celebrations that are about to start in. But for now, they're doing pretty good. The vaccines are still proving to be very effective against the Delta variant. There are many breakthrough infections, but almost 80% of deaths are of unvaccinated people, which any deaths are not good, but that just shows that if you have the vaccination, you're not likely to get very sick if you do get a breakthrough infection. And of course, older folks tend to be more heavily vaccinated than younger ones, so most of the deaths now are focused on the younger age groups. I started to say 50 and below, but I think it's even like 30 or 40 and below where most of them are coming through, including quite a bit of pediatric cases. Here in Shelby County, the CMS reported 14-day positivity rate is 2.8%. It's up slightly from last week, but it sort of seems to be just fluctuating along that 2.5% to 3% level. A few months ago, it was almost 18%. So we're much better off there. And it's actually pretty close to what the low was in the summer. It got down as low as 2.1%, and we're heading that direction. I talk about the transmission rate, which if it's below 1, that's good. If it's above 1, it means COVID's growing a little bit. It was below 1 a couple of weeks ago, but now it's at 1.09. Not bad, but hopefully it'll get down below 1. Here in Shelby County, the average number of new cases per day over the last week was 121. And that's up from what it was a couple of weeks ago, but still pretty good. It got up to a high of 750 average per day a few months ago, and now it's getting way back down. Hospitals are not as overwhelmed with COVID as they were. I think now they're still getting some, but now I think the bigger problem is just their staffing shortage with nurses. Hospital wings are closing. Services are sometimes being denied in certain areas just because they don't have the nursing staff to handle all of the beds that they could fill at the hospital. I'm told by the local health and medical professionals that the biggest risk now is unvaccinated people from the outside. Here, we're all vaccinated. Most people have had the booster shot even, and within here, we're pretty safe. Any risk would come from people that might come in who are not vaccinated, or have even vaccinated people that might have picked it up from those on the outside. I want to keep mentioning every time we talk, Delta variant symptoms are not necessarily the same as the traditional COVID symptoms. They may be, but you may have a sore throat or sneezing or coughing and it be COVID. We had a few people that tested positive said, I thought it was just allergies. So if you have anything like that, think about it, talk to the doctor or call the clinic and see if you need to be tested. We are still testing employees and contractors periodically in accordance with CMS and CDC guidelines. The frequency varies based on the COVID activity, whether there's any positive cases here and things of that sort. Currently, things are good enough. We only have to test unvaccinated employees monthly. At one point, we had to test everyone twice a week. So that's a good sign because they pretty well stay on top of that. And it's been several weeks now since any employees or residents have tested positive, which is a very good thing. Here in Shelby County, 49% of eligible people are now fully vaccinated. 50% is, it looks like we're going to make it. That's nothing to brag about based on what other areas of the country are doing. But they're thinking that one saving grace there may be that enough of the other 51% have had COVID that they will have some built-in protection from it. They don't think it would be as much protection as having the vaccine, but there might be some. So, the good news, if you look at people age 65 and over, which covers most people here, 80% are fully vaccinated, which is one reason why the majority of people getting sick, and certainly those dying, are younger folks now. The more mature and smarter people know how to take care of themselves, and we're all doing that. You'll recall about, 2.5 weeks ago, we had the booster vaccine clinic here at the village. 223 independent living residents that we know of have now received the booster. 188 residents have received the flu vaccine that we know of, and we still have plenty of flu vaccines in the clinic. If you've not been vaccinated and would like to be, just drop by there and they'll take care of it. On the day that we got the boosters, any eligible employees also got it. So the majority of employees have the booster. Some of them have to wait a little bit longer before they can get it. I don't know if you've heard this in the news, but there's now rumblings about a second booster shot. And as of now, they're saying it would come 6 months after your first booster shot, but they're saying that it would only be for the moderately and severely immunocompromised people. At this point, they're not thinking everyone would need to do it. Moderately and severely immunocompromised might be those who have had liver transplants or something of that sort, or perhaps maybe certain types of chemotherapy. I've talked with our doctors around here, and I don't know if there would be any people at the village that would qualify and fall in that category. If there are, it would just be a handful. But if you think you might be, and when it starts getting to be several months after your first booster, you may want to ask your doctor about it and just see if it's recommended for you. As you know, we pretty well monitor everything daily to see, are we doing the things we should do in terms of precautions? Do we need to change things? In the healthcare areas, of course, we're pretty well told what to do by CMS and federal agencies, so that's what we do. Here in independent living, we start with CDC guidelines and then local regulations, and I consult with medical doctors who specialize in this sort of thing, and also local health professionals, and we make the decision what we need to do here. As of today, wearing a face mask by residents will be at your discretion. And we're not having a village mandate at this time. If you do come in close proximity to other residents and you know that they are more careful than you might be, and would prefer to, and would be more comfortable being around people with masks, I'd just say try to be a good neighbor and be considerate and respectful. And I wear a mask almost everywhere I go, but on the rare occasion I don't. If I'm around somebody that I know would feel better if I did, I do. And that's just, courtesy. So let's try to do that, but it's not something we're going to police, and it's up to your discretion. If you do leave the village, I would really recommend wearing a mask anywhere you go. I do, and you just never know, because you get outside and the person standing next to you could be sick as a dog and they're just going on anyway. People do that. So just use good judgment and make your own decisions with that. The precautions that we do are in consideration of the best interest of all residents at a group. And if things get worse again, we'll do what we did before and have to go back to wearing masks. But for now, I think we and all of our advisors are comfortable here not doing that. Everyone's vaccinated. it's about as safe an environment as you can get, but it's still not foolproof, so just recognize that. Visitors that come in, including your families, still need to wear a mask in any public areas. Employees still will be wearing masks. They would like it very much, including myself, if we didn't, but for now, we're going to keep doing that because typically, employees, not me, but a lot of them are younger, and they're going to be around more people who may not be vaccinated, and they're going to be around more people in general on the outside. So that's one reason we want employees to continue wearing masks. Visitors that come in may be fully vaccinated, they may be perfectly safe, but it's not really administratively feasible to keep up with, this one's okay, this one's not. So the best thing is if all visitors just keep wearing a mask when they come in. In your homes, they can take it off if you tell them they can. We have, as I mentioned, in the healthcare areas, we follow CMS guidelines, and that's a federal agency, and it regulates us, and we have to do that. CMS on Friday, about 4 o'clock in the afternoon, issued new guidelines for visitation. And they seem to have a knack for doing that when you don't really have time to react without, making it difficult on people at nights or over the weekend, but that's what they did, so we had to deal with it. A lot of our residents here go visit others in the healthcare areas, whether it's the long-term care or skilled care, memory care or assisted living. And we have a few spouses here that go over to visit their spouse in those areas. And that's great. We encourage that and want you to do it. This visitation guidelines by CMS will impact any of you that go to the healthcare areas to visit someone. So I want to walk through what it is. CMS has essentially gone from being extremely careful to sort of almost anything goes, to be honest with you. They're saying that any resident now has the right to receive any visitors he or she chooses at any time, at essentially any place. And appointments are no longer necessary. There's no limit on the number of visitors they can have, although large groups are discouraged. If 20 of y'all want to go and sing happy birthday to someone, I wouldn't do that. But, they can bring in 2 or 3 or 4 family visitors. It used to be limited to 2 at a time, and that's okay. And there's no limit on age. They can bring the great-grandbabies in or whatever they want to do. Any visitors who have tested positive for COVID recently or meet other requirements for quarantine, or even if they're feeling like they may have symptoms, please don't go. Just stay out if there's any chance that you might be infected. Residents and guests must use hand sanitizer at the beginning and end and wear a face mask anytime they are not in the resident's room. Once you get in there, if you and the resident are both fully vaccinated, and most of ours are, if they agree to it, you can take it off. But anytime you're going to or from their apartment, you need the face mask on. And when you go in the entrance, go straight to their apartment and don't loiter out in the hallways or anywhere that you might come into contact with anyone that you are not going to visit. If we end up having any residents that are pretty severely immunocompromised situations right now, so I won't get into that. When you're going to their apartment or back, 6-foot distance and wear the mask. Also, just a reminder, if this impacts any of you, the residents in those areas are free to leave at any time. Hopefully they'll come back, but they can go visit with family, go to dinner, go to activities or anything of that sort. They're free to go, whatever they are comfortable doing. One other thing I would mention, those of you that have been over to visit know that you can't get through the service entrance that comes out at Care Base 2 in the healthcare area. and we still have to keep that off limits. You still have to go to the main entrance of healthcare because CMS still requires that we screen all visitors into the healthcare area. So you have to have your temperature checked and everything, and we can't do that at all the entrances. So everyone has to go to the main entrance of healthcare. If you're visiting in memory care or assisted living, feel free to go through that main corridor that goes by the Oasis Salon, and you don't have to go outside to go to MCAL. You can go through that area and get there quicker and easier as well. Let's see. Let me catch up with myself here. On other matters, today we are having active shooter training for our employees. The first one was at 8 o'clock this morning. There will be one, I believe, at 2 o'clock and one at 5 o'clock. And most of our employees will be participating in that. We had that a couple of years ago, and it was very good and helpful. And every now and then we like a refresher course on that. So we're having that. Before too much longer, we're going to have a safety presentation, probably by the Germantown Fire Department and Police Department, and it will cover a number of emergency situations, but it'll also include the active shooter scenarios, and that will be for residents, so we'll let y'all come in for that. In the meantime, let me tell you one of the simplest things they tell us in that class to do. You know the typical rules, run, hide, fight, and somebody pointed out to me, we're not really good at running in here. So if you're not able to do that, get out of the way. But one of the simplest things they tell us is to use a rubber doorstop and put under your door, because if you have that, it is almost impossible for even a big guy to kick that in. And if you don't have one, you might want to get one. I'm going to get some for home as well and keep those. So they teach you things like that in this class. It's pretty good. The resident survey has now been completed, and thank you all so much for giving us a good response rate on that. I haven't seen the report yet. The consultants are still working on it and compiling all the data. But we'll be getting that before long, and as always, I'll share that with y'all. We'll have a meeting and show you the results and talk about it. Again, I want to remind everyone of the gift policy with our associates. They're not allowed, and at Christmas and other holidays, sometimes people like to give a gift, but we have to prohibit it for a lot of reasons of our associates, and that's what the Resident Council's gift fund is for, that most of our residents contribute to. It's not sponsored by the village, it's totally the Resident Council, but they use that and give a very generous gift at the holidays to our associates. And that is so that residents don't feel bad about not tipping or giving gifts throughout the year. So please help us with that and honor that policy. You all got a few days ago my letter about Medicare replacement insurance. I've already received a couple of pieces of hate mail from, I'm exaggerating, I just thought that'd be sort of funny. But that's a big exaggeration, but mostly from a couple of people who think it's wonderful. And I said, look, I'm not trying to tell people what they get. I gave the impressions we have on it from what we see at the village, and that's all it was. But if you do get one, just go into it knowing the good and the bad, and of course it's your decision. Let's see, in activities, the Christmas and other holiday decorations will be going up around the 30th of this month. We're going all out just like we do every year, and I think it's going to be beautiful. Tomorrow night, Dr. Stephen Threlkeld will be speaking to us. Anybody that has a TV or a newspaper knows Dr. Threlkeld from the last couple of years. He's probably one of the biggest local celebrities we have, and he is on our board of directors as well, and he is one of my primary consultants that I go to. He's been very helpful to us. So come to that tomorrow night at 7 o'clock. We have a holiday event in the form of either a presentation or a party or a dinner or something almost every day through the end of the year. Our dining staff is getting ready for that. They're going to be really busy, mostly resident events, but also that I give you some information about dining. A lot of people with the buffet we're having in the Monarch right now, we still hope to end that soon. There's still just a server staff shortage that makes it hard to do. The ones that are the bigger eaters love the buffet, and the ones that are not such big eaters want us to get back to regular table service, and we want to do that as well. But in the meantime, the biggest concern with that is that we're not able to cook the filet mignons and put them on the buffet because they just don't keep well. So if you want a filet, we will be serving those in the evening only out of the Bistro Cafe. And you can get the filet cooked like you want it, and 2 sides and a soup or salad, and that would count as a meal plan, or if you don't want to use your meal plan on it, I think Maria said it's $14, which is not bad for a filet dinner. But anyway, that will be starting Monday. I think they've got to stock up on tenderloins to be able to do that. I had told you about Maria going to memory care and assisted living towards the end of the year, and coming in as director of dining will be Jesse Crittenden. And then lo and behold, in Sunday's paper, there was an article saying that Jesse was going to be the director of dining at Trezevant. And so all of a sudden, I start getting calls from people panicking, thinking Jesse's not coming, and that's not the case. Jesse is coming. Trezevant had this article. It's just a little the people in the news thing. They had it written before they knew he would not be joining them or staying with them. And that is now in the newspaper Sunday. And I suspect someone at Trezevant is getting yelled at pretty bad for not pulling that article before it got printed. But so if you saw that, or if you see it or hear about it, let everyone know that is not true. Was it Churchill that said the rumors about my death were greatly exaggerated? Well, the rumors about Jesse are also exaggerated. He will be coming. Earlier this week, we had a campaign to check batteries in pendants. And almost everyone, I think, came to do that, the push-button pendants. If you did not, drop by security. We've had a number that apparently are not good batteries. And drop by security and let them check it. Just go by at any time, and security will check it. If it needs to be replaced, they will do so. I think it was on a one call or something earlier this week asking people to do that. So, but no problem if you haven't, just go by and get that done. I want to, let me see. Yeah, I want to introduce our Associate of the Month for November. I usually do this at resident councils meetings, but we're not having one this month or next, so we're going to do it today. And that is Sarah Gibbs. And Sarah, would you come up? Come up a minute and let me embarrass you a little bit. Sarah's been with us 6 months now, I believe, 6 or 7. And she's doing a great job. She is an IT specialist. And, you know, one of the difficult things about bringing people into roles at the village, they need to be good at what they do. And a lot of people are. But they also need to be someone that fits in well in our community and likes our residents, and residents like them, and has a great attitude. And Sarah has all of that. And she does a great job. She will go to any extra mile to get anything done and to help. And I've gotten a lot of comments from residents just talking how much they appreciate Sarah. And your manager also recommended you, by the way. That never hurts. Just to give you an example, someone said that they discovered something wrong with their computer, called Sarah for help, and she got it done. So far, so good. And then this person's son had said, "Mom, you need a new computer." So Sarah took it upon herself to sort of build one or come up with what she thought was needed, and she emailed that to the son and to the resident, and he wrote back, "Wow, Mom, that woman is spot on." So they got it, and something about it still didn't work, and all she had to do was this or that, and it worked just fine. And one of the things the resident said, Sarah is smart, kind, and very helpful, and we're blessed to have her here at the village, and thank you for hiring her. And on top of that, they said one of the best things is she doesn't say or do anything to make us feel stupid when it doesn't work. And I personally agree that is important, because I'm the same boat. And on top of all that, she knits and joins the Loops of Love ladies weekly and has a good time with them. And I think that's when she gets her work list for the next week, knowing what she needs to work on. So, Sarah, thank you so much. And would you like to say something? If you do it in this.
Okay. I just want to say thank you all for making me feel welcomed here at the village. And you're all very good for my self-esteem. Thank you.
We are happy and fortunate to have you with us. Thank you. My next talk will probably be around the 1st of December, give or take a little bit. The holidays will be messing up our usual schedule, but we'll get one in again before the main holidays start up. Are there any questions? Yes, ma'am.
I have one related to the elevator. I was on it and the power went out, and then lights were on.
Mm-hmm. It would be. The question was, if you're on an elevator when the power goes out and it doesn't move, what do you do? If the power goes out, there will always be security here. Most of the elevators, which one were you on? Do you recall? H. Okay. Most of the elevators are on the emergency power generator and would power on. For some reason, when the building was built, there was one or two that were not put on the emergency generator. And you happen to pick the right one. And but we're all aware of that. And if that does happen, security will be here at all times, and they will. You could push your pendant. It is now. Yes, ma'am. Oh, in the security office. Yeah, it wouldn't work. The call button may. It didn't either. Okay. You can push your pendant, but security also knows that if the lights go out, they need to check and make sure nobody's stuck on there. So even if you didn't push your pendant, they should be doing that. I understand. I'll tell them to try to do it real quickly. Any other questions? Yes, sir.
How is the planning and or scheduling for the work in the locker room coming? Is it getting to the point where
It is past the point of needing it. The question was, how is the planning coming along for the renovation of the pool locker rooms? It's coming along very well. We have a design pretty much agreed upon. We have one price quote received, and we're waiting on another one. And we are hoping to start that first quarter of 22. And we're doing both locker rooms. It's going to be a total renovation. It'll look like brand new places when we're done. So the biggest problem is you'll have to go home to take a shower for a little while that's going on. But once it's done, it'll be great. So it shouldn't be long at all till we start that. Yes, ma'am.
I hope that when they put wider,
I will check. I believe the plan was to have a little bit fewer but bigger. And I will make sure of that. If we're not able to do that, would you just be sure and wear your smaller shoes that day? I'll look into that. What other questions? Yes, ma'am.
Explain what you meant about.
Explain a little more about the active shooter training that we're doing. We are not all being given firearms or anything of that sort. The training is if heaven forbid we were to have someone come into the village and shoot people or threaten to or be a risk of that, what can we best do to protect everybody and also ward off the shooter? So that's what it's designed to do. It's an informational program to say, as soon as you hear about it, here's what the staff are supposed to do. Here's how they go around checking. Here's what you do with the police. The police will tell us generally there's not a lot they would want the staff to do. They'd want them to sort of help corral people and then mostly get out of the way and let the police do it. And fortunately, we're right down the street from the police, so they would be here very quickly, and that would help too. But it's an awareness program just to let the staff know what they should look for and do to help. And the other one that we have later would be more to tell the residents, if you believe that's going on, what do you do? Yes, ma'am.
This is not a question, it's a comment. I think the pandemic is doing wonders for our brains because every week it's something different that we have to keep up with and change. And it's keeping our brains sharp, I think.
Well, every cloud has a silver lining, doesn't it? Mrs. Buckmaster said she thinks the pandemic, for those on the TV here, is actually helping with our intellectual stimulation because it gives us so many new things to keep up with each week. And I think you're right there. And it also led us to add more activities than we used to have to give us things to do without having to leave. So, yes, ma'am. It would. Good question. If you were to use the rubber stoppers, door stops, when should they be used? And it would only be while there is actively, you believe there's a shooter around or somebody that might be trying to break into your home. Don't keep it up in there all the time because then security couldn't get in and EMTs. And if you press your pendant needing help, they can't break the door down, most likely. They may try to rappel down off the roof and crash in through the patio window. Don't do that unless there's just an immediate belief of a danger, and then take it out when that's done. Any other questions? These are good ones. And they're fun ones since I know the answer. That always helps. So, okay. Yes, ma'am, Ms. Sandusky.
I'm wondering, does everybody know, particularly the new, how to get into the building if it's after 10 o'clock? When it's locked?
Okay. The question was, does everybody know how to get into the building after 10 o'clock when the front doors are locked? No, ma'am?
Sometimes 9 o'clock.
Or 9 o'clock, whatever it may be. Yes, you're right. Sometimes it's earlier. Essentially, any of the doors that have the keypads still operate after that time. We may lock the ones that stay open at the front entrance just to keep anyone that might get through the gates or anything from getting in when there may not be staff at the entrance. But you can still use your pendant or your code or your card to get in any of the entrances that have those. If all else fails, if you get locked out and you don't have that, just call the village, the main number, press the button for security. I believe it's number 5, and they can let you in. Yes, ma'am. Something to add to that?
Well, the reason I suggest that is the night my husband died, we called for an ambulance, but first of all, we pressed the button and the security guy, and there was only one on, well, came to the room to help do this. So I was out front waiting for the ambulance so I could show them where the apartment was to bring them. So I went outside forgetting, had never been told, I had just moved into the building, how to get back in, and the ambulance driver didn't know either. So we were outside and I was panicky trying to get in, get to my husband and what all was going on there. No security guy, because the one security guy was in the apartment. So I was banging on the door, screaming and hollering, and I think it was a guardian angel, because I've never been able to find that person since then. Came by, opened the door, I thanked him at the time and ran to the room. But at that time, there was only one security guy, which now I hope there's still now 2 on at night.
What year would that have been?
And I insist that everybody who moves into this building knows how to get into the building after it's locked down.
He wanted to know what.
That was almost 6 years ago.
It is, it's really rare now if we ever have a situation where there are any fewer than 2 security staff, at least one being an EMT. If the second one is not an EMT, there'll be a security staff. And their procedures are that one of those would be helping the person that needed help, and the other one meet the ambulance to show them where to go. The ambulances have, trying to think if they have, you'll notice at the elevators especially, I'm not sure about the entry doors, you'll see these little red boxes on the wall that are not real attractive, but they're required because they have a key in there, and emergency personnel have a way to get in there and get the keys out. That would be, I think it's a master key to get in just about anywhere. But I need to find out, and I will, if they are able to use that to get in the building, or if it's just once they're in, that will work in apartments and elevators, for example. But you're right, if it would be difficult if there's only one security person at a time there, and that would be very rare. I mean, we at least have 2. Yes, ma'am.
Does that mean that at night or
Yeah.
off hours?
If they need to, there are times like the ambulance will know where to go. Somebody's talking with 911 and they will tell them, go to this entrance or that, and they'll meet them there. If they're going to healthcare area, one of the nurses will meet them, and it's usually not a security person. If they're coming to independent living, they will tell them the closest entrance to come to get to a specific apartment, and they will meet them there. They have to have something. Typically, a security person will meet them there and actually show them the quickest way to the apartment.
Someone automatically go out to
Yes, ma'am. If the doors are locked, they go to meet them, yes. Usually, even if they're not locked, they'll be standing outside when the ambulance comes up and escort them to the nearest place. Anything else? Okay, thank you for coming. Have a good week.